Now that the FDA has approved Botox injections, it is the fastest growing cosmetic procedure in the country. Botox helps to get rid of wrinkles, and we're joined today by Dr. Randy Weil and one of his patients, Deborah Phillips, who actually has had some of the Botox treatments, so we can talk to her and see what she thinks about them. Thanks to both of you for joining us.
Thank you.
Let's talk about it. First of all, I mean, the popularity has just really soared, and you're seeing so many advertisements out there for Botox. But, Doctor, how can someone be safe about it in choosing the right person to go to?
Well, it's a very safe injection, so I think people can feel pretty comfortable that really very little is going to happen to you.
Okay.
But basically, if you just go to someone who's been doing it for a while and is a licensed physician, now there are some nurses can do it as well. So that we have Botox parties, so a lot of times you will not be having a physician doing it. So I think you just have to know the qualifications of the person doing it.
And a Botox party is what? A group of women, I would assume, getting together and
men now too. Men are doing it as well.
We won't leave them out.
They have co-ed
Everybody wants
Botox
to
parties.
Look good. But everybody going in as a group, I guess,
That's
and getting it done?
correct, right.
It's a relatively simple procedure.
Relatively simple. It's like collagen. People are very familiar with collagen.
Right.
And it's just a few injections in the areas that are most commonly done, either in the area near the eyebrows,
right,
or the forehead, or around the crow's feet.
Okay. Now let's talk about Deborah a little bit. You just recently, you got some injections yesterday.
Yes, I did.
How many did you get?
I did 3 sites. I did this area here, and I did my the glabella, the area between the brow, and I did the lines up on top in the forehead area.
Now, why did you want to get this done?
I do it for preventative reasons. Obviously, I'm still fairly young.
Sure.
I have 2 young children. I take good care of myself, and I do it just to maintain my appearance, my youthfulness.
And what have you thought of the procedures?
Oh, it's simple. It's very simple, and it lasts between 5 and 6 months, so you don't have to do it that frequently. And it doesn't, you know, you still have full expression.
Right.
You don't,
because that is something
face.
that people talk
Yes.
about as well, that, oh, if I get rid of this, then all of a sudden I'll have a stale face,
Right.
that no one can tell if I'm smiling or not.
Right.
Which is not the case.
It's
Right.
not the case at all. But it does wear off. It's something to consider, you know, for both reasons. If you don't like it, you want to obviously get your expression back. Or if you need to upkeep this. So every 5 to 6 months you need to go in.
Yeah, some people be 3, 4 months, other people 5, 6.
Okay. Are there any dangers to it at all?
But the only thing we found is that if the injection's near the eyebrows, you can get a little droopiness to one lid, which is temporary.
Okay.
But that's about it. It's quite safe.
Are we seeing, what are the price of some of the injections? Does it depend on where you get them done, or?
Most people
How
will,
many?
most people, it's depending upon number of sites. So a lot of times there are 3 sites in the forehead area and around the sides. So we go by one site maybe between $350 and $400, and it can go up to $650 or $700 for, say, the whole area.
And, I mean, Deborah, you're young, beautiful skin, beautiful person. Are you finding people that are younger and younger getting it done?
Yes, I think so. Actually, we have a whole range of people that I've talked to that have had it done. And
People are pleased with the results, it sounds like.
Right.
Going back.
And it does take some of the fine lines away as well. So
let's take a look at some
benefit.
before and after pictures that I believe that we have as well that'll kind of give you a great example, because Deborah, you look great already.
Thank you.
Well, this is between the eyebrow area. This is probably the most common area, because a lot of people feel as though they look kind of, when they're frowning, they look angry, right? And so it'll soften those lines.
Okay, let's take a look at the next
And here are
one.
the crow's feet, another very common area.
Now, those markings that we see on the before picture, are those just the injection sites?
Yes,
or?
exactly right. So you'll get maybe 3 or 4 along along that area.
And it kind of, what is it? It plumps up the area and it disables the muscle in the area?
Yes.
Is that what it does?
Yes, it creates, the muscle will not fire, so it cannot contract, and it's the contraction which causes the wrinkle.
Now, is the patient going to feel any heaviness at all? I mean, do you feel like there's a weight there at all?
No, none.
no.
You don't at all?
I can feel everything, yeah. And there isn't a heaviness at all.
And would you continue to get it?
Yeah.
You continue now?
Yeah,
so I guess.
absolutely.
Is it something, though, I mean, once you've started, you can't stop?
Well, no, you can stop. I use it as I would use skincare, you know, products. It's just part of my regime, I guess.
Well, and it's becoming part of many people's regimes, and, you know, a common thing that people are getting now. Thank you both for joining us.
Thank you. Thank you for having us.